Hi, everybody. Thank you for listening in. We're going to talk about motivational interviewing and how this can be used to help our patients that have fatty liver and, changing their lifestyle. My name is Erin Tanner. I'm a nurse practitioner for Gastro Health in Birmingham, Alabama. I've worked here for 14 years and do general gastroenterology, which includes hepatology as well as IBD. So let's get started. Motivational interviewing is basically a collaborative approach with our patients, and it's centered around guiding them and counseling them in a way to encourage and motivate them to change their lifestyle. There are several core principles that we can consider when discussing motivational interviewing, and we can use the acronym RULE to remember these core principles. R stands for resist, writing, reflex. So we want to avoid telling patients, hey, you should do this. Hey, you should do that. We should talk with our patients and instead ask them, what are your goals for your healthcare? What are your goals? Or what do you think about when you hear you have fatty liver? That's what R stands for, resisting, writing, reflexes. You understand motivation. So we want to ask our patients, hey, what are your goals for your health? What would you like to see or achieve in this lifestyle change? That's what U stands for. L, listen with empathy. So when we discuss things that are preventing our patients from changing their lifestyle or making better choices, we don't want to be judgmental. We want to be empathetic and listen to them and really address their concerns that they have. And then E, we want to empower our patients. We want to encourage, empower, and give them, great encouraging words to continue on with their lifestyle change. When we talk about examples of open-ended questions and reflective listening, there are some techniques we can use to help guide the conversation. Some questions we can ask our patients include, what matters to you about your health right now? What would you like to be different? What are some reasons that you would like to change? Tell me about your strengths that you have that would help guide and encourage this change. And then also we do want to discuss concerns that they have or hesitations they have that would prevent any type of change as far as their lifestyle goes. As far as using motivational interviewing to be realistic and achieve our goals, there's another acronym we can use. We can use SMART goals, SMART, and this stands for specific, measurable, achievable, relevant, and time-bound. So when we're talking with our patients, we want to repeat and rephrase what they say. Patients may come in and say, hey, I really want to be more active, but I work all day and I'm very exhausted at the end of the day. And we can just repeat and rephrase and say, I hear that you're exhausted at the end of the day. You don't feel like exercising. Let's talk about that. What are some ways that we can guide through that? Reflection. I hear you're frustrated. I hear that you wanted to wake up early and go exercise or prepare your meal to take to work, but your kids were up all night. We can reflect on that. We can have empathy with our patients. And then also affirmation, when they do achieve some goals. Hey, it sounds like you're very committed to this. I'm very proud of you. You've done such a great job. All of these things go such a long way when we're talking to our patients about lifestyle modifications and changes they can do to help improve their diet and exercise. And then when we're talking about the SMART acronym, when we're coming up with a care plan, basically, we want to be very specific in our goals. So, hey, what would you like to do? Or what could you do differently to change your weight or to be healthier? And a very specific goal would be, I would like to walk 30 minutes a day. Okay, that's very specific. And then we want a way to measure this outcome. So what are you going to do to help hold you accountable? Or what can you do to be accountable? Well, there's multiple apps on our smartphones, their pedometer, our trackers to measure how long or how far that you've walked in a day. And then we certainly want this to be achievable. So coming in and saying, hey, I'm going to walk 30 minutes a day, 7 days a week. That may not be very achievable or attainable initially. So let's dial it back. What about if you walked 30 minutes a day, 2 or 3 times a week? That would be very achievable. And then we want to know why this is relevant. Why are you doing this? Are you doing this because you want to lose weight to improve your fatty liver? Are you doing this because you want to have more energy to play with your children? These are very relevant aspects to discuss with our patients so that when they're out there walking, they remember while they're doing it. And then we want to time bound. So just seeing our patients and saying, okay, go walk 30 minutes a day, 3 times a week, and I'll see you back in 6 months. No, let's do a telehealth appointment. Let's see them back in the office in a month. Let's reassess how things are going. Let's talk about their hesitations or their problems they're having achieving that goal. Or if they have achieved it, hey, let's make it even bigger. Let's walk an hour a day, 3 times a week. Following up with our patients, having this close communication with them, this is what's going to help motivate them to achieve their goals, which in turn is going to improve their fatty liver, help them to lose weight, help them to have a better lifestyle. And then let's discuss strategies for addressing patient ambivalence or resistance to the recommendation as far as lifestyle changes goes. This has to be a partnership with our patients, and the process of change is owned by the patient. That gives them the autonomy to make the change. So if we can just be great encouragers, we can have great recommendations for them, but this is owned by the patient. So let's talk to them, motivate them to make the right choices, and then we can just be their cheerleaders on the sideline. Thank you all for listening. If you have any questions or concerns, please reach out to me.